the dreamers, we make it happen. Guess we believe it. Look who we are the dreamers, we make it happen. Cause we can see it. Here's to the ones that keep the passion, respect, oh yeah. Here's to the ones that can imagine, respect, oh yeah. Gather round now, look at me. Respect and love the only way. If you wanna come, come with me. The door is open every day. This 1+2 rendezvous, all invited. This what we do, how we do. Look who we are the dreamers, we make it happen. Guess we believe it. Look who we are the dreamers, we make it happen. Cause we can see it. Here's to the ones that keep the passion, respect, oh yeah. Here's to the ones that can imagine, respect, oh yeah.
نحلم إنه يكون العالم أحلى ونعيش بحب ونتجمع ونخلي صوتنا يملى هالدنيا حب ونتكاتف نرفع وتفرق ونتعاون نصنع ونحقق وما نستسلم نتحدى ونتجاوز كل شدة ونغني بمودة. Look who we are
the dreamers, we make it happen. Guess we believe it. Look who we are the dreamers, we make it happen. Cause we can see it. Here's to the ones that keep the passion, respect, oh yeah. Here's to the ones that can imagine, respect, oh yeah. We are the dreamers, we make it happen. Guess we believe it. Look who we are the dreamers, we make it happen. Guess we believe it. Look who we are the dreamers, we make it happen. Cause we can see it. Here's to the ones that keep the passion, respect, oh yeah. Here's to the ones that can imagine, respect, oh yeah.
Alhamdulillah pertama kali kita lakukan di 2022 secara
Offline.
offline, ya, secara offline.
Hai Pak Rifan.
Okay, cool. Again, welcome for our podcast today. Today we'll talk about digital framework and solution. We have a special guest, Dr. Manto, want to hear from healthcare practitioner that and how can we contribute as a technology to provide the juga dari kita pertama. Ya, jadi sebelum kita mulai, kita dengan dulu dari Pak welcome ini. Sudah datang di rumah kita di Persatuan.
I think you need to say hello to all the
Oh,
audience.
okay. Oh iya, iya. Halo everyone yang ada di luar sana di manapun yang masih online tentunya. Selamat datang di acara kita yaitu podcast pertama 2022 yang bertema Digital Twin for Healthcare Solution. Di pada siang hari ini kita ada key person yang akan bisa memberikan nanti pandangan giving some value or view that we can discuss today. This is open discussion. Everything related to the topic we will discuss in terms of the specialist background that we have. Ya. Jadi harapannya teman-teman nanti yang ada di online juga bisa juga bertanya langsung, khususnya Pak Novan dari Menara Tertinggi di Jakarta. Kita juga welcome nanti. Jadi untuk lancar acara kita tentu dari Pak Luni di welcome space. Oke. Berdiri kan ya, duduk aja ya. Oke, kita tentu. Pak. So hopefully this podcast has some insights, some business insight of how to so let's set this first podcast that we run this year. Plus, initial part of the course. So, probably, this is one segment of saya rasa itu. Jadi terima kasih sekali lagi. Welcome to the audience. Seperti tadi sudah disampaikan juga, appreciate any participation, any question, any audience. Discussion. Good agenda. Looking for all of us, and then come up with some ideas that can execute. Saya rasa itu. Terima kasih Pak saya sebagai tambahan juga dari Pak tadi, semua yang berpartisipasi akan dikawal. Akhirnya ada. Jadi ini saya menarik. Kita betul-betul partisipasi baik dari going forward. Nanti dari teman-teman. Jadi itu tambahan. Lebih lagi kita mau dengar dari Pak dipakai sebagai spesial tamu kita juga. Dan baru juga berjoin dengan Indonesia. Sebenarnya masih fresh banget. I think Pak Dipak is my fresh perspective. You want to hear from the perspective of how can we address this, or how can we view this opportunity.
So I think thank you for so now for this podcast discussing fresh new topics, and definitely I think in the next few months and years we must do more of this. I starting like this very soon. The larger sales team and other people they will benefit from this. So I would say one quarter target all the particular topics. That's the first thing. But in terms of the specific topic, definitely digital twins have been a buzzword for many years now, and they're cheap, valuable. They are marketing, manufacturing, and the idea of replicate whatever real time situation. Observe it, simulate those biggest benefit. Method of not having to learn the hard way. Basically, you don't have to make mistake all the time. You have a digital twin, experiment, and so on. By the way, like all of your software development is pretty much like having a sort of test server and having a production server. A sense very similar. That's just the concept that we take into space. Specifically on healthcare, I'm not an expert to discuss more about it. But I think having concept for this healthcare is even more important because the human body will be rather than do R&D on the actual body, or rather than estimate what is going to happen in the actual body. I think this is a clear forecasting method of knowing what is going to happen. It's very interesting topic for many of us.
Next one, but insight. I think we got some people that are the one for the and then side. Better want spectrum because we have a special case for managing this is special fine for game to come to Jakarta for this event. That's one. So that's why we want to honor you.
This is part of the BSO.
All other trips are part of BSO.
I think because of let us start with the main agenda. The speaker will some topic that they prepared. Later on, finish the topic that our speakers they will Q&A session. Again, I invite whoever participates, we will come. There will be some special game. Okay. For speaker, tonight, briefly tell the person. Okay. The speaker.
Okay, thank you. I think again, like you were saying, we don't want to make it like a monologue. We can keep it like a discussion and dialogue. Of course, there is some content to anchor the thoughts, but I would say start with main 3 points. One is that, like Deepak said, digital twin is not a new concept, but maybe in healthcare, it's still evolving. The market overall, at Accenture, what we see, and we work with large telecom operators like Indosat, and work with the medical practice, the ecosystem partner, that it's definitely a huge business. It's an $8 billion market is what people estimated, and it is growing by more than 40% till 2030. This innovation, the digital twin for smart health market. So it's a huge market. anybody to get. And it involves all of the, I think, world, world, $8 billion, just 40%. But I think the key message, it's not the market size. I think it's a platform like this which will make it successful because everybody in the ecosystem has to equally participate. And again, I think I wanted to emphasize points that because we are dealing with human beings here, more than technology, which is what Accenture is known for, it is the ethics, security, the privacy, the regulation, which will be important when it comes to implementing digital for smart data, because we are dealing with actual human data. We're not dealing with digital twins are very successful in a couple of industries, specifically manufacturing, because you have the machine, create a digital twin, you have a physical object, you have a digital object, you have a data which is getting exchanged, and it is beneficial to everybody. So whether it is manufacturing, whether it is full product life cycle which is being defined, the digital twins are very, very critical, very, very successful. Everybody sees there's a huge potential in smart health, but I think as a part of this industry and ecosystem, all of us must really see how can we do it ethically, how can we make sure that the patient privacy, security, and we are not violating any of them. So if we move ahead, I think what I wanted to kind of set a stage for all of us is that one, digital twin has various definitions. If we go to the next page, please. So I think there are digital twins, there is digital thread, there are digital shadow, there is simulation, model, lot of different words people use for defining it. But for a discussion purpose of today, I would say that twin, which is actual digital model of a physical thing with a bilateral data being exchanged is important. And more than that, in context of smart health, I think the digital thread is also very important, which means that in a whole life cycle of a patient care, right from let's say diagnostics or pre-operative, doing something in the hospital, in the clinical care, to post care, preventive. I think all of the data, how do you create it? How do you use that for benefit of future patients as well as the patients who are undergoing some kind of treatment is more important. So I think that digital thread are the two important concepts. And again, there are variants of saying whether you want to call it a shadow, whether you want to call it a virtual model or a simulated model. All those things are important, but that's what we need to understand. I think the message again from learning from other industries is that when we look at the ecosystem, whether it is devices, the sensors, the cloud technology, the data and analytics, technology is now mature. If we want to use it for the benefit of humankind, I think the platform is ready. It is only up to us how do we use it for the benefit of mankind and for the healthcare ecosystem in the healthcare industry. If we move to the next page, I think again, like I said, that it is not just the digital twin, the whole life cycle of data collection at various stages of healthcare is more important. So along with digital twin, the digital thread is also important, which is not just a single system. It is rather saying it's an architecture pattern that how do you collect the data end to end and how do you use it for the various sectors of healthcare. If we go to the next slide, we go next. I think I quickly wanted to say that when it comes to technologies, I think, like I said, everything is available at our disposal. All these things on the left, which are on the technology side, are pretty mature. I think it is the application of it, which is what we need to work more on it. I think there are great applications there. There are large healthcare companies who have already created a lot of models, like Dassault Systems in Europe or Siemens in Europe. They have created a full model of an art, and they can work on it and they can do all their treatment on it. And so that they have used this technology to create it. But I would say all of this probably as an industry, and again, we can discuss when we open the forum for discussion, we should use this first for a care management or a hospital care, which is where in geographies like Indonesia or India or for other large geographies, where the doctor to patient ratio is very skewed, is very less, and we need to make our healthcare system more efficient, our hospital management more efficient. I think that probably is the starting point before we start going into, and again, the clinical trials and on the preventive medicine before we go into saying, can you really treat a patient who are digital twin and do a remote surgery and make it? I think those applications are a lot, but we have to be cognizant of the fact that we are dealing with live human beings here. What should be our roadmap? Which use cases we should focus on as an industry and an ecosystem? So that's my point. So if we go to I think precision medicine again, with the digital applications have done a lot of work here, and in the end, the motive of this is how do you make it efficient? How do you make the effectiveness or the efficacy of medicine more important? Is where digital will be very important. If we go to the next page, I think even in the clinical care trials, the technology is going to help us a lot, because otherwise finding right data sets, finding the right target versus control, how do you run those clinical trials, and I think in pandemic we have seen it, that if the medical community goes beyond something, they can make it successful, whether it was in getting the vaccines right and all those things. I'm sure these technologies in future will really help. But if we move on to the next page, I think, like I said, the hospital or the hospital management or the hospital operations is where we believe that a lot of technology-related initiatives can help us make it much more efficient. And that's what we believe at Accenture. That's what we believe the ecosystem is working on. And I think today in the panel we will discuss more of it. That how can we make it more efficient for this country, for this country, and from here, what can we take to the rest? So with that, I think I'll hand it over to Timo.
Yes, before we go to it's clear from the Accenture so far, actually much of the technology side by side out in the healthcare sector. In order to do that, let us see from the perspective. A lot is the acceptable, because when they do the W design as a practitioner, we are helping.
Yeah, I think basically this is very interesting. Where are we actually going to the precision medicine, or actually I rather use the terminology for people care. So it's more the terminology is more complete, preventive, predictive, participatory, and personalized. Yeah. So the precision side usually more into the personalized, but I think this will be including how we are going to make or break the health budget actually in the next 20 years. Because if the government cannot cover all the spending, which under the public health insurance, then it will be catastrophic for all of us. Right now, for main catastrophic disease like heart and cardiovascular disease, stroke, including cancer and like kidney failure, it costs 80% of our budget. Crazy. Okay. So even cardiovascular related more than half for the catastrophic. So let me introduce myself. My name is Dr. Bimantoro. Dr. Bimo. I'm from Association of Health Tech Indonesia. Yeah, next please. So basically we founded in 2018. We do partner with the ICT Ministry, or more like healthcare digitalizations. We also help in the AI innovation of like AI National Strategy with BPPT in 2020. and we have the model or trial for regulatory sandbox since last year, and we are going to have the health tech regulatory sandbox perhaps early next year. It was prepared for end of this year, but I think it's going to start early next year. And with the Satu Sehat initiative from MOH, with the DTO, Digital Transformation Office, pushing this, our members will help to integrate around 7,000 healthcare facilities with currently 35 million EHR. Next. So this is very collaborative method also that we are doing when the data analysis is quite common. But we see that we are coming from the mostly startup background, and also the community inside the healthcare professionals need to be together. We need to upgrade ourselves in doing the digital transformations, of course, with the backup of government and academia, right? Because a lot of things happen, the change will happen a lot in the campus, right? And with the power of media like this podcast, we see that it is pretty much allowing more and more people to understand about the digital transformation. Next. So we have around 120 members, 7 category. So information system is the most members, and on-demand healthcare also. We do have like teleconsultations, media, also e-learning, online marketplace, and even an AI, IoT, and genomics. Right? So we are pretty much diverse associations, but health tech itself has been included as parts of the healthcare industry by the MOH since the digitalization. Right? So we see that we need all of this. I mean, to create a digital twin, there is a lot of partnerships need to happen. Right? Not only one company can do it. Next. So it is quite actually. In a few years, and the company, I don't know, still exists or not. Yeah, I don't think so. But the point is, digital and genomics is going to change the healthcare. I mean, it's not going to, it's now changing the healthcare. I mean, with the digital and the convergence with the genomics, that's precision medicine. That's precision medicine. The twine between digital. So we see, I mean, in the US, one of every 3 persons looking for the health information online. In Asia, it's around 1 out of 5. So it's quite big. Okay, next. So we are going to see how this will happen with a lot of MOH initiative actually. So since last year, it was named previously Indonesia Healthcare Service. They rebranded just before launching mid of this year to Satu Sehat. I think it's Satu Data more kind of name. Right. So the MOH is committed to do like transformation in 6 pillars. The widest one is actually about the primary care. This is part of very important because when we do tackle the health problems, it's like preventive, and if you go predictive, then the health spending there is unnecessary later on because we cut. Right? So even if we are bigger, we have bigger budget, like from around 100, I think around 120 dollars spent per capita in Indonesia now, and we are going to like Malaysia 4 times. I believe we could see that how many trillions rupiah Indonesia is not going to handle that well, right? If everything go to hospital. So we are happy that the government tried to put it in a primary care and do more like campaign in preventive and promotive. Okay, next. So, but it's very interesting also that the precision medicine in Indonesia is in the making with the GSI initiative, Biomedical and Genome Science. By the way, this program is under the DTO, the Transformation Office MOH, and it is part of the 6 pillar, right? One of the pillar is around health tech, telemedicine, and this genomic, right? About the pushing the technology. So I think MOS already opened the Health Biobank and human genome sequencing. There is a lot of interesting parts of this happening right now, but I think we are jumping, not directly building all the center, but utilize whatever that the teaching hospital and university, right? Because they all have all the expert there, right? One university have so many professors, so many researchers. Is are the one that utilizing. They are connecting with the clinician because mostly doctors who are academic are also practitioners, like clinicians. So it's already a good intertwine. Okay. Next. Very interesting about the 4P healthcare, right? System biology and system medicine. I mean, a few years back, if you're talking about this, people will laugh. Right? It doesn't make sense about digital twins. Right? Why someone would, yeah, how would someone build that? I mean, yeah, it's just a matter of time. Like human genome sequence. I mean, the project, genome project, is 1,000. Right? And now we are aiming to less than $200 full human genome sequencing. So the system approach, the digital revolutions, and the increasing numbers of patients and consumers have already took the healthcare online. Right? This is very important basic. Next. And we see how the healthcare will move from the reactive phase. So people will see doctor only when they're sick. Right? Now we are collecting the health data even when we are speaking now, right? Through all the IoT devices. We are going to see a lot of application for pregnancy. Yeah, I mean, athletes will be in forefront in this digitizing or quantifying human, like quantifying stuff. But more and more data will come, and this will include not only digital data but the omics. Omics is like the genomics, metabolomics. I mean, when we create the genomics, then we could do all the kind of simulations about your metabolism, about your protein. So the data regime will blow up, and of course, data centers, the communications. This is very important. Okay, next. So we see how is the developed digital health sensor from head to toe. Okay, there's a lot of device for almost all organ related, right? Even like continuous glucose monitoring, right? It seems very simple, but you'll have a lot to make, because like right now, diabetes patients need to check like 2-3 times a day, like you prick yourself, it's hurting yourself actually. If you're masochist, it's okay. Yeah, but a lot of people are sexually afraid. Okay, so with a CGM, continuous glucose monitoring, it will be very much easier. Okay? It's a medical device, of course. There's a lot of other consumer health device quite advanced in even predicting the blood pressure, doing for like predicting blood glucose is still in the making of the AI to help this. Okay, next. So we also see, I think you have already shared about this, but basically how to move from biology data models and then digital twins, right? Because it's very important. Right now, the medicine in general is doing something that research perhaps done for the white Caucasians mostly, but even like not even like Indian. Right? I mean, most population on Earth like China, India, but it's mostly because the research came from Europe, from US. Right? So when they came to here and try to do like, I mean, Indonesia diversity is crazy. I mean, a lot of companies came want to do anything about AI, about this kind of human model data, because Indonesia have one of the highest diversity in mix of all kind of people here, right? So this one will create a representation that will help understand, right? conditions, and hopefully it will also predict the outcome of whatever treatment create through digital. So next, next one. Okay, this is the last slide, I think. So basically, what we want to do is to have digital twin constructed and create unlimited copies. We can see how the computational network or the computational medicine. Yeah. So we know the components or the active ingredients of medicine. I think we are talking about like cancer. We are talking about any advanced diseases that more and more people like having. Right? So and then how this could be tested through the digital twin. But if you are not talking so far, what the pharmacogenomics has done is right now actually with the genomic data we have, that we can create this digital twin. Okay. But actually, we already know the genome, the gene sequence related to respond for the medicine. Right? So if like you are having somebody will have heart disease. Okay, there's a lot of modality or the type of medicine that will be given for you. Yeah, with a lot of different mechanism in your body, metabolism with this enzyme, there's kind. Yeah, we can learn that through digital twin, but we already right now know that from this gene sequence, which one is actually better for our body, right? That part also create a huge saving. Right? So you don't need to spend any money that because medicine works in a guideline. So if the first year medicine, yes, you'll be given those first year. But if you already know or the report is there, the medical record saying that the genomics will work so better this kind of medicine, right? So you just jump, okay.
You directly go to the step 3 rather than just going from 1 to 2 to 3.
And I believe all of this was actually created in a digital twin before.
Yeah.
Right? I mean, how could we could predict that? I mean, the genomics, right? The genomics is just a sequence, right? Okay, the gene sequence. So there's a lot of applications, but we already see like in a pharmacy and a few of startups in Tech ID actually, like Nala Genetics, Nusantics, they already done this. Okay, next, I think. Thank you.
Thank you. Tadi teman saya Ari, saya tanya apakah memang teknologi atau digital transformation atau jadi tantangan atau buat dokter atau gimana nih dokter? Oke, saya berani nanya karena berasal dari mulut dokter ini.
I mean, it's very simple. This is the future stethoscope. For doctors, AI. This is the future stethoscope. Yeah, it is a tool, right? I mean, at the end, the clinical decision should come back to the doctor. Okay. Yes, it's a DSS. I mean, we can see a lot of paper related with how the DSS create opioid pandemic, opioid epidemic, right, in the US. I mean, there's a lot of research about that. But I think the doctors is the final decision to do or not. Right? So it is a stethoscope.
I think it is able to run in digital that is only like the replicating physically to the digital one. So then meaning this is the same like we visualize all information on it. Still different. That's different. I think that the question should be what happened if we, for example, right, I can easily guess on CT scans and data and then something like that. So then this is the thing that automation can believe or.
No, I think what is very important is now an access to the healthcare itself. Like, I mean, how many people in Indonesia has do CT scan? That do MRI, right? I mean, the numbers of I think we in the early of pandemic, we also having the task force of research innovation COVID-19, TFLIC-19, with the BBPT at that time, right? So the problem is like, okay, we have this kind of CT scan, but the RSUD, yeah, the local hospital, they cannot send all this data. So they send the hard drive. Wow, we are going back to 90s, sending hard drive. Cool. Yes, okay, it's even faster. Even faster, just to send the hard drive. 2 days, then upload all this kind like more than perhaps like 500 gigs. Yeah. Really, but yeah. I still remember those days, sending hard drive.
You know, how are doctors reacting to it? Are they adopting technology, or they feel insecure that all this technology will make us redundant?
I think in Indonesia, we always see those kind of two. I mean, everywhere we see those kind of two.
The naysayers.
I suppose. Usually, the younger want to adopt faster, okay, kan? But the one who works established want to like hold everything. Right? But the point is like, yeah, you cannot beat the technology, right? We need to embrace, we need to use it because it's helping us anyway. If you're afraid that your job is gone with that, just learn it, right? Then I mean, the only way is like to learn it. I mean, luckily, healthcare professionals have all this like CPD, like continuing professional learning, yeah, CPD. CME, continuing medical education, or CPE. And then we can always put what is just before pandemic 2019. I mean, there's a lot of I have for. I mean, I haven't seen industrial revolution ever discussed in medicine in healthcare. Then suddenly, at those years, everyone is talking about.
Healthcare industry is very regulated and exclusive.
Yeah, because it's very asymmetric. Very asymmetric.
Top valuation before I continue. In your presentations before you said that. I read that they have 400 startups in Indonesia. So then the question is, if there are so many outside, so why I still see not only the primary but not only secondary, the primary practice is still using very traditional, delivering the services from accepting the visit of the patients or delivering the medicine, etc. is still using very good business process of using the applications. What is the issue? How do they see the difficulties of implementing the system?
I think basically in transformation and any parts of like those three basic like leadership policy and the human resource. So I think a lot of times, yeah, the leaders, I don't think they're not aware, but they are still facing difficulty with themselves. It's still hard to accept. It's better way. Yeah, I think about the policy, I mean, all the regulation and things. Now, the is enforcing the EMR until end of next year. So, yeah, I'm thinking like this is 370 days. We are talking about 370. I was just 31 December 2023. 100%. Must be crazy in a year. And I think the last one about the human resource principle. Professionals or clinicians are not used to digital workflow. I mean, let's not talking about digital workflow.
Still manual writing. Understood.
digital workflow needs to be introduced, how they change, because if they cannot change how they work in the digital model, very hard.
Last question. So, what do you expect? What will be the main goal, the challenges? As you are the technology co-founder, what do you expect?
I think we can do a lot in educating and embracing how to do in the digital, so the transformation will happen smoother, rather than directly selling all those features, all those cool stuff to the healthcare, because eventually they're just saying it's like a gimmick. But what we really need is how to make them like see or feel the benefit of doing digital transformations.
Yeah, I think that's better approach. Not selling the product, but selling the solutions.
Yeah.
To solve the pain point.
So we could really see how is it going to benefits all the healthcare, the management, clinician, all the support in the healthcare, rather than we selling the cool stuff, because it's giving gimmicks and okay, later on.
From Data Lama, versus Data Lama also involved the case for
How collaborate with project.
Sure.
Share discuss my flights.
All right. At least we are the same spectrum. So I want to check that one first. This opportunity for participation today. We will hear from Mas Supriyan what can open.
Yeah, actually before we heard from Dr. Bimo, from Spanadin, the future technology. So but again, we need to know what is the safe vision to start. I think yes, Dr. Bimo said that I think the gap is very long. Okay. The future is there. But somehow now we still can see that in Puskesmas, even in primary services, they still very how to start that one. So when from the teacher become to get teacher. So that actually my presentation is just to cover a very physical approach with how the operators see as an editor of all the players here. And as practitioners creating the solution, and also for the hospital itself, how the lighting can enable ecosystem to next plus. Actually, this has been discussed before. This is things that we see as the six key trend that probably become to critical things that operators need to see from this industry. We know that like COVID, our health become those years of delivering that. Even I still using this, even though probably many patients they best to use the physical interaction with the doctor, but I still use this not only because of cheap, but also it can give me very fast response. And data sharing, I think now into this wearables, everybody start to share their personal data, healthcare data, etc. to cloud, and then probably they don't think this is. But I think based on the survey, many patients, many people, they tend to share all the data in order to give better analytics on the healthcare. So then this is information. And then some of utilizations technology on AI, I think in COVID,
Mas Selendra also creating technical, right? How to read diets from visual data, AI, and you can identify what is the disease, something like that. So that is something that you can see AI has been there. And RNTR also in some cases already, yeah, in artificial and virtual reality has been used. How some doctor do the surgery, they see the planning for and not the medical from how to set the yeah. So then using this one again is easily find out where is the role there. So then this is the thing that we can see probably industry now ready after the digital way. But the question is how to accelerate this digital transformation. So next, this is then again this is maybe refer to satu sehat. I just quote from DTO document about some framework and strategy, how to build the platform. So then, as I said, I want to cover the physical thing. This is the thing that become two main challenges currently in primary and secondary healthcare practices. Data readiness, many hospitals still use very traditional way. So then, sometimes when I visit them and then they cannot just enter my name, right? They need to open the cabinet and then go out the save something like that. So this is very manual. So you can imagine how come that I visit the same chain and then they need to open paper archive. So this is very dangerous. So this is one of the issues currently faced by all the institutions. It's inconsistent data, scattered and silo information, and some of it probably overlapping. Okay. Sometimes in the VGS cases, for example, patient need to have CT scan and and then and visiting the hospital they need to do the same. This is overlap data. Yeah, I don't know whether this is needed, but if we can use the same difference, probably. So then by having this issue, the government, the DO, will be trying to see what is the 6 main principles to build. This is their ambitious they want to build service platform, meaning that all the data that will be shared by all the hospitals will be based on delivery, meaning that after patient come and then service delivered, this data should be transmit in the real time. Because currently all the data is only reporting data. Probably periodically like one day, 1 week, 1 month, something like that. If those aggregate data, the government cannot identify actually how to see the pattern. So then their expectation is all the data can be delivered immediately,
almost
near real time, something like that. And then there will be no intention from the government. They want to provide single platform, single applications. They just want to have standardization. So then around all those 400 startup and all the hospital can still use their existing applications, but there will be standard communications, how to exchange data using API. And I think this is good, because they just want to invest all the industry by giving open platform, so that every every party can build their own application. So this is the plan, and then how is the approach next? Actually, DTO divided into 3 steps. One is how to integrate all the health data system, meaning that they don't how to provide a single information set about starting with the hospital first, how this hospital can create standardized data and then share. And then after that, integrations on the application. And after that, we talk about ecosystem, how to intercorrelate between its applications. So with this one, okay, this is the priority next. This is the priority, right? Number 1, maybe focus on creating the same data first, single data. And then I think for this one, the question is how to help all the hospitals to get capture the data, because the data can be data, right? I mean, the data from the system that has been collected by hospital information system, or maybe for the medical system, and the other part is the asset, the hospital assets, like probably they want to know how many occupancy for the bed, etc. This is something that currently still being used. So how collect all the data and then put it on one repository and maybe visualize for hospital. So this is the thing that we try to see from this one. Next, Mas Arif. This is our approach. Okay. So then we propose that this is our joint collaborations, meaning that we don't expert on those areas. We don't know how to do the scientific on healthcare, right? This is again, this is very regulated, very strict, very exclusive areas. So we want to find something that we focus on. For example, in the infra, we know that how to collect data from single things. For example, from how to collect data from hemodialysis usage, we know how to do that because this is not too far, but if I get from machineries in factory, we can easily retract data from PLC, from any kind of machineries. I do believe that we can also retrieve data from those machineries as well. And then we know that in every data transport is very needed. How to move data from one area to the other area, like Dr. Yasin, right? In hospital 500 here, for example, how to transport those data. But then, currently not only delivering common infrastructure like home, actually we provide also private network solutions. So this is specifically for all the company that would like to have a dedicated network with very specific policy for data communications. So we can easily define one site clause in our BTS, only support one company, for example, with specific policy, IP policy. We can do that. And also in operations, we have ready applications related to smart asset management, OK, etc. Because currently we still found that many hospitals that usually record storage, cold storage. You can imagine, right? If they come one by one in the lead just to record, suhunya berapa? It's very dangerous. What happens if sometimes probably somehow the electricity down and then the temperature drop? Then what happens with the batteries, for example? We build this application ready for tracing the full databases. In the other part, we have some platform working with Google. Actually, this platform has been there for many times, like visualization, data analytics, artificial intelligence. That I think this is the thing that can be used by all the players here in this industry, just to ease the implement, meaning that they don't need to bother with finding what is the right analytic platform. Why don't you use this one and then use your knowledge only to do the main thing here, like all the infrastructure built by the cloud services, for example. So this is the thing that we encourage actually from only hospital, but like from the health ecosystem, part of this ecosystem, and then build the solutions together. Thanks, Mas Arif. So then, this is our approach answering this plan from EO. Number one, we see that A is the first step, integration and development of cloud data system. I think in this part is the how to retrieve data from analog data into digital one. So in this part, actually IoT sensor devices is very common that we can use. So we can help to provide this and incorporate with existing solutions that already and then after that, hopefully by having this digital data, we can visualize all in one single data. And maybe we can combine the data from, let's say, they can see how many seats that idle, how many hours already work. I just look at, for example, like the hemodialysis machines. Yeah. For some of those people, they don't own it. This is not their asset, but this is rental, right? So we asked by this rental company, one that renting this one, how to put some sensors to change the business model, because currently the business model is based on monthly. They want to offer based on the usage something rather than the. So this is the thing that we can think together and how to down lowering the cost by using technology so that the business model can be enabled. Something like that. After we digitize the data, hopefully it is part all the thinking, all the brain in this industry can start to how to replace the data. So then for this one, we can enable, we can accelerate this industry by using a common platform. And Google, of course, because currently we don't build that, but Google has it. So then, as our currently, Indosat is backed by Google. No? We are one of company in Southeast Asia. No, in Asia Pacific actually, only supported by Google with digital contribution program. They don't replicate this with the other operator in this region, only with Indosat. So then, we're not only building all the technologies, but also with the brain, with the people. So then we hope that we can leverage this support them from them, accelerate the transformations in this area. Okay, next. Actually, and yeah, this is the simple example that we can do. Maybe we see from the very basic one how to utilize all of these analog information, recording, for example, like availability of the sceneries, or maybe just to record the features on cold storage, right? Or even later on, if we already touch it wearables, we can also help to provide the infrastructures to collect for the data collection. And then after that, all the driver company can massage this data and then make it into more informative way. So in this one, we have several platform built already that can be used, and some of it even already built as an applications like blockchain, asset management, power management, which is probably not really direct connected with healthcare, but I do believe that in vision activity, this application is something that. And I think the next agenda is how to connect this all information into Indonesia satu session, right? Enterprise integrations, the ESP is very important. So currently we have a very long experience with API because we manage maybe terabyte data yearly, so we know how to exchange this data with the other party, with the other technology. We can replicate this platform to support all the industry to provide simple API or ESP, enterprise service. Then later on we can have standard data. So hospital, they don't need to change the applications, but we bring this as a bridging with this Indonesia satu requirement for the data. Next, yeah, this is example applications that we can build. For example, to monitor the equipment in hospital, we can any sensors for, let's say, to the bed. Yeah, we can see if this asset is being moved to the other room, etc. We can easily show for the sensor itself. It can be very low. It can be using the BLE. Also can use the other sensors. I think that's all from our point of view. Like
next month, very for but why? How can we want to achieve? But this that's really
Yeah, I think security is not, we cannot talk security piece per piece, right? Because whenever we talk about security, we need to ensure from the device to the server, this is being protected. The way we transmit the data, I think the security that we implement is security by design, meaning that at the beginning, define it to be comfort person on security. For example, on the physical thing, we need to ensure all the device and sensor cannot be doing by someone, right? For example, if we see the machine, they can easily plug in the USB, right? And then they can do something. So then, in this part, we need to ensure all the packaging, all the closure, it is being protected. That's number one physical thing. On the protocol also, we need to ensure this protocol for all the communications that we build, this has been covered security standard. I think in cellular, we know that we have a very strong security, right? So then after that, on the block one, this is the thing also the other part that we need to protect. And I do believe that there will be so many models on the data transport and protections. And then the other part is on the application, how to protect the application from various threats actually. So I think all solutions has been covered that has been considered for security.
Thanks, coming back to this word approach. So far from the sensor and the IoT. That's a helpful. What do you think? Hey, you're beginning, of course. Yes. So, what do you think about our approach?
So I think there is 3 points that we need to collaborate more and work together. First one is we need to help the clinicians, management, and all related to the healthcare to understand about what the heck are we talking about. This is something different in their work. I mean, I've been in the middle of hospitals and technology partner fighting each other. Well, what you guys are doing for the right, you're doing the right things actually. You're doing, but the way people see it, the clinicians versus the management and versus the technology, this is also the factors you are need to work together, right? So we need more and more to help them understand about what is actually happening. And transformations is not technology transforming, right? I mean, the transformation doesn't happen with the technology; it happens with the people. It happens with the healthcare itself, right? So this is something that that's why I mean, AHI as our association, we work also with executive ministry, not only with MOH, so executive ministry. We also work with other ministries to make this happen. And the second one, there is a lot of misleading about how the device connects with Satu Sehat. It's like I heard some project saying that, pregnant woman got USG scan, then data submit to the MOH. I'm always asking guys, are you sure? Are you sure? No, doc. It's going to the Puskesmas EMR. Okay, then after going to EMR, then the EMR will go into integrated.
Probably only the result that
Yeah. So that's the problem. That's a very basic thinking. I mean, it's good for publications. Any device can go to the missile, but also make people afraid. Right? Out of nowhere, their data from device go to the MOH. It's frightening for a lot of people actually. So we need to make sure that it all happens under the healthcare facility EMR. Right? And the EMR could be on premise, could be on a cloud, could be mixed, synchronized, whatsoever, and that's also your part. And the digital telco network. And the third one is, I think this one very interesting because a lot of health tech members are, we want to help the government. Right? So with a lot of healthcare facilities provided by these startups, then how we could connect this with a standard. I mean, we are basically doing the HL7 fire. And I just received an invitation saying, 22nd is Thursday, right? So we got invitation to Bali. This is Monday. Well, in the end of the year, everyone is very busy. The invitation just came. I mean, it's good. It's good. We have been asking this for months. Okay, it's good. But this training of trainers, then what happened will be like, okay, we do this, then let's say teach other startup or members to do SL7 fire, then not connect everything. I mean, the hands are limited with the government. And this part will be interesting because now you got also part of this. You can to help all those developers, all the system. I mean, not only startups. I've seen a lot of system developer integrator out there that actually doing for the hospital. Now we can do it together. Your Inexas partner will do also the SL7 fire. And talking about fire, it's actually Google Cloud. That's one of the strongest fire. But they don't implement here. It's still in the Singapore, I think, the nearest one. Okay. So if we could also take that, we could help to do. I mean, the one who use the Google.
Yeah, this is
Yeah, the one who use Google. I mean, there's a lot of cloud out there, and yeah, I'm sorry that I'm saying that we have asked AWS, we have asked Ali, we have asked everyone who run this cloud because. It is on cloud and they already have put the protocols. Why do they need it? So there's an opportunity for you here actually to help educate, to help integrate, and of course make the ecosystem more interesting.
Yeah, I think another concern is previous case in data breach. This is similar thing, right?
Yeah.
Video is coming from the video bullying is coming from video. Right?
Yeah, I know.
What happened with this one? Even with the simple solutions like that one, we cannot perfect.
I'm seeing more opportunity actually as you.
I think we need to
No.
Mas Setiaji then.
Because the point is here is everyone is facing. I mean, I think doing the hospital is the early phase, but they are changing to Puskesmas, family care clinics. I think actually to catch the numbers right. I mean, it's much easier. So with all those like 60,000 in total healthcare facilities, then they got private practice. Right? But most of the numbers that could be changed easily is like Puskesmas and primary care clinic. But hospitals, as you that implementation in hospital, very big headache, very big headache. Right? So a lot of people fighting that I don't know why, but I'm just saying that if now they are doing it Puskesmas and primary care, and the next step, I have just talked with a few of hospital chains. They already integrate themselves. But when doing integration in themselves, it's very hard. Right? Now they are doing this integration to the MOH. And there will be a lot of business conflict, I think. Okay, so, but again, it's opportunity.
That's good one. You can see that all of the devices must be very cheap. Yeah, very thankful for having so you will explain what the chipset is. In the Explorer, we have a discussion earlier that and then we shorted also.
And somebody trying to put a chip in your brain.
Oh, I see from
Yeah, yeah. Way in the day, yeah. And we do the charting.
but we know to access. So secure for us to share that. Keep potential and somehow secure for access along the way. That's right. A lot of whatever. But we have those problems. Anything we get wrong, but just looking at that, we should make can you see that? Oh, no. Everything is that this is this, but then or whatever diagnosis or recommendation, suggestion coming from the data, that also important. That somehow is clear. That if they are not satisfied, then we get another data and then we do analysis. We don't any comparing the data. It's just only for us. That is said this. Whatever like, but at the end we will have a benefit that we use. So then whatever the other for 100 people, then cost the government. Then those money very, very, very powerful. I think not only for all that is part of the digital side.
Yes, digital health life cycle.
Single, correct. But I think the question is whether this single form of the database is compared with decentralized. For example, in Australia or in UK. So I see it was from my
Yeah, as a
yes.
patient, as a yeah.
I don't care about what the organization or government will do with my data. First, I need to have my copy. Once everyone during the smart city. Yes, not in the smart city. So with have those information, then probably because currently the data is not belongs to the patient.
Yeah.
This is hospital medical record. And we do the project. Because one level problem. That is comes from the in which country currently they already implemented model, meaning that all the patient they all their own data they can be.
I believe there is one that already successful with that, with all this kind of data integration, data integrity. There is not centralized.
You all know Estonia.
But they start with Estonia, and I almost, that's what I mean, I can use my Indonesian. I know, yeah.
Thank you very much.
It's very interesting. I could say like Australia are trying to be NSS or trying to be one of the most successful use cases.
I think blockchain based.
Yeah, because they are built on blockchain. Correct. But before health record, then all those kind of citizenship, yeah, because they're based on e-citizenship, like, and you can apply, but please in mind that you will lose your Indonesian yeah, because you cannot. But it's very interesting and how they do this, all those kind of digital government. I don't know. I know the reason because they start boring. They have nobody.
It's small countries.
Yes, the very small country. They just like out of the world. And, okay, we don't have anyone to run the government. And, okay, let's put it in the system.
Sometimes it's easier to start anything we do from scratch.
Yeah.
That's why they put this
Okay, thanks. So that by having boundary, one is the that's going to create ecosystem, or even what kind of a solution that Intel has been improved or collaborate with the some solution for banks, maybe the link with the survey. This.
Yeah, thank you. First of all, I would like to thank you for being us here. I believe many of you maybe wondering or questioning why does you one part of this conversation, what's interviewing with healthcare. I believe you maybe most of you know Intel as a chip manufacturer, not only chip with Intel is chip level that build the CPU on the desktop, etc. And all the question is right, but on this occasion, I would like to share more about how I think it should be interesting.
I'm not that surprised.
Yeah, because
Alata have come, right?
Yeah.
I know because people of Alata have come a few years later.
yes. So if you, I don't create a specific slide there presentation for this discussion, but I only capture from our website. So if you go to our website, www.intel.com, you find this page and basically, so what I would like to highlight here is you can see the menu and there's a products. Next, please. So if you go to the product, you can see many familiar names on the left side. There's a Xeon, Core, Pentium, etc. Then this is a product, we call it a component. So this is our business line. So this is our business. But now already moved beyond here. So we already transform ourselves from PC center company to data center company. Means that everything or every component that we build is already optimized to process the data. Next, please. So if you go to the solution menu, we have a focus on some industry solution. You can see here that there's a healthcare and life science. So, next, please. On that page, you can see many interactivity that we need to healthcare and life science. Today, we have some focus and some practicals. So, what I want to share here is there's many things and many products and technology that Intel have built and developed play its role in participating or contribute to the development of the healthcare and life science product solution. So, On that page, we share some use case that we work together with our partners, let's say GE, Samsung, and healthcare players, and what they do with, or what they healthcare initiative they would like to do, and how Intel support them. Next. So, next, please. After this, I would like to share about what contribution that Intel do with it. Okay. So, I like the AI in healthcare and life science meeting. So, basically, what the Intel contribution beside the computing engine, of course, all the machine, the computing machine, the machines already use Intel inside. But here, I want to highlight that Intel also play in AI part. So how Intel play the user intelligence part in healthcare and life science. So here, Intel play not only as a product or component provider, but we play our role as technology provider. So how we become a technology provider? So here's some use case that we support to enable the use case that using technology. There's AI in medical imaging, precision medicine, predictive analytics, and anything that are already mentioned by you as well. So next is some of the example. One of our partners, they develop lung scans, AI-powered lung scans. So next, please. Basically, how the solution works is read the image that produced by X-ray or imaging device, and they automatically using AI to determine the condition of the lung itself, the disease or any condition related to it. So here, how Intel can support the partners to do this kind of solution. So maybe not all the name here is familiar to all of you, but I just want to share that Intel has more than just a processor. So we have on the left line, we have here Intel DevCloud for one API. So DevCloud is actually a sandbox. It's a cloud-based sandbox. So all the developer can test the coding, the application running on specific hardware. So you can do the testing without having the device physically. So you can do the testing on cloud. Basically, we put our various processor from the CPU, GPU, FPGA, all of the products that you can see on the products menu on the cloud. So you can do the testing. Second one, there's a TensorFlow deep learning framework that already optimized on top of Intel hardware. So if you do the development using the TensorFlow, we also provide the TensorFlow that already optimized for Intel hardware. Also, we developed the Intel AI Analytics toolkit to analyze the AI process that the developer have developed to do the analytics of the jet. Yang biasnya atau yang bias ya? Intel Xeon is the processor that most used in server, bukan yang of course, it's more expensive than the commercial Core i9. Xeon, there's some classes of Xeon as well, Xeon Silver, Gold, Platinum, and Center. Basically, we use Intel Xeon. So in our CPU, our Intel Xeon, it's not only to do the computing, the basic computing, but we also equip the features like Intel Deep Learning Boost. This is like a features that to accelerate the AI process and running on the Intel Xeon. So we also have the Intel OpenPino tool for Genome is an influence engine to do the intelligent process on the video analytic of the image process the line. Next. So the other sample is one of our partners is Denver from Germany. They developed the prototypes of medical calculations. Next. So basically, we try to build the digital twins of our lungs. So, part of the first step is to get all the data collected from our body, from the lungs. We visualize the thing. Just like masuknya Dr. Bima said before, all the benefits. Next, please. So, same before, here, we will use technology using the resolution of the kernel library and Intel C++ compiler, also the Intel Xeon Scalable processor. And one thing I would like to add here is Intel computing powered by Intel extension or Galaxy. So confidential computing is very important in medical or in healthcare industry. So it's related to the security of the personal medical record. So Intel, from the hardware perspective, basically talk about the computation layer. We, from the hardware, the computing side perspective, we have the SGX features that will protect all the computation that happen on the specific machine that running on top of our CPU. So you can do the encryption and related to the security of your application to be bound to the machine. So if there's someone tell themselves that I'm the admin but coming from another machine, you can get the data, or maybe you can get the data, but you cannot get it. Things like that. So by using SGX means that we don't trust the operating system, we don't trust the admin. We only trust it all coming from the machine. That's what we do. Next, please. So we look at the roadmap, what Intel help. So basically, we not only develop our processor, we are not only Intel Xeon or Intel Center GPU. When inside the processor, we developing feature like Intel Deep Learning Boost, Intel Advanced Vector Extension, or AVX 512 for the high performance computing, and also the security Intel SGX. From the software side, so basically, Intel not only a hardware company, basically Intel can consider as maybe the top 3 largest developer, the company with largest numbers of developers. Why? Because of the developer is testing our hardware and make sure that our hardware is running properly and optimized to all any kind of software from OS perspective to the application layer. So no wonder we also develop many toolkit software that can be used for developer to optimize their application that are running on top of our hardware. So the develop also now we have Intel is more related with the model training, AI model training. So when you create the model, you develop the Intel platform for Getty to faster the AI model development. So if you want to try or to want to build any new AI model, you can do faster with Intel.
It is understandable. Can use as commercial.
Can use as commercial. You can do it in cloud-based or on-premise as well. Next, please. Next. Yeah, so how we support the ecosystem. So we have many programs, many partnership programs that we provide from and for our ecosystem. There's an Intel AI in production, so this is for our partners only at the production or prototype stage. So we integrate them in this program. And then Intel AI builders, since they already have some things, build some things that not commercially yet. And then the RFP and market ready solution. The solution is already commercialized. So we help them to go to the market with bigger market like worldwide, for example. And Intel Select Solution is the solution, for example, for healthcare solution. So it's easier for partners or user to find a solution for partners that work specifically for. Next. So, yes.
Okay, so before you go to Mas Yoga, I think we just released our paper. One of like the exploring statistics. You know that now all technology has also very high data, like video analytics. So that in the future we know that there will be convergences between possible. There will be simplification on the process of the data like that of flow, right? The learning will be not directly. Then the question is there a platform to take to comment right layers.
Yeah, basically what produces the component itself, then the software. So the way those technology can be implemented even in a single device depends on our audience. So part of our ecosystem is Intel OEM. For OEM, OEM is like HP, Lenovo, or OEM is like Compaq, AMD, or many other appliance builder. So there's one use case maybe I can share is Noteplugs. Noteplugs, they develop the system is not using DVC. So they use our chipset called Intel Mobius, or we call it Intel PP, that already built inside the camera. But the purpose of this camera is only for inferencing process. So basically, they already built the model, and through the Intel SDK, they embedded the model into the camera, into the system. So Intel or OEM, we only share the core design reference. So if Yosa or any partnerships who would like to have that kind of device or solution, from Intel we can connect you to the OEM partners. We can support you to build that audience. We only provide the technology. We don't build the finished product.
But their chipset is very important because this is maybe some of fact that we face in the field. Right? Many smart cities that cannot buy. They want to implement something like that, right? But this is for physical purpose. Tracking the people, citizens, etc. But with 6,000 camera like that, that's very expensive, right? One box, every camera. So they expect if you replace this with box, yes, box with camera or camera with box, but it should be right. And that cannot be done if chipset and applications running smoothly, meaning that
there will be additional SSD, etc. It's very expensive. That's similar as when people create chipset, they're already embedded with ideally just need to maybe update all the library and then this interesting will be done on images. There will be no high bandwidth transport needed, right? Because everything can be done on the edge and then data only can be sent to. That's one of the solution. You can connect it to the device. That's should be
Thanks, Mr. Navid. I think let us have a coffee break first. We already provide
Maybe we can go
5 minutes.
only 15 minutes. Maybe we are not more than 15 minutes. Maybe to conclude and then.
Okay. It's okay also. So I think from all of the speakers all of us the technology any kind of industry we are very involved in helping that people for any future direction that and also along with our partners was IOH will come with the partner as well. Partner, for example, like devices manufacturing or technology, expert solution. Then, yeah, we will come in the one solution. So that, I think one of the experiments that we can have that some of the books that we already read. So later on we will have something. Yeah, there is smaller group that we can pull up. Maybe perhaps that we can fit with your requirement level. So that along with partners like they always have experienced that before. One of the devices that they have so many parts at the time. There is some traction. Discussions for others. Yeah, and the other use case that we were explore funding also one of the. So I think the spirit of collaboration is good there. And our partner. Maybe for closing value or that's from business perspective.
I think it's not. This is yeah. Yeah. Yes. Show the way. Yeah, I think it's but I think that it problem is because not only has detailed domain, also has sense. Just what right? We hoping that you can get these services because how can this really is need, right? So we can put this as our additional value. I think that they will in this very heavy So let's see this as a mutual cooperation, meaning that we don't deliver practices, but also we bring our own ecosystem in this process. That hopefully can push players like hospital to see is we don't only bring the technology, but also we bring the potential users. This is, I think this is a mutual thing that we can see about.
Yeah, I think the point in collaboration is like really giving each other values that we could share together, and this later on become much bigger, not only for healthcare actually, but for all for all nations, right? So I think the first thing that we need to do together is we still have to educate a lot of people, clinicians mainly, the management. I mean, you have to do implementations with data on the ground, mass. I think there's a lot of policy from the leaders that is not aligned with the transformation. So we need to do that hard work together, because if only one or two do that, it's going to be forever, and not going to reach the target, but or the aim. But if we do it together, we want to share resources. One of the models like this podcast, but we can explore much more of that. That's just the first step. And second one is how we enrich each other in values, and then like not only bringing the technology side, but also what is the benefit for the hospital, for the healthcare. Benefit for individuals is very straightforward. I mean, it's very straightforward for individuals. But for hospital, a lot of questions. For BPJS Kesehatan, Universal Public, I mean, the biggest public health insurance on earth. Now, it's very clear for them if those data is connected. No need to be checked. Data is there. Hospital or data from where, from clinics. But from healthcare business, this use case is still questionable. Okay. Why should I share my yes, but it's the oil, right? If you think data is the oil, no, data is the oil since forever in healthcare, right? It's there. Okay, so we need to work it together, and the third part, I think, as health tech been included in the healthcare industry. I mean, this is very interesting. So now we could also the same. Yes, yeah, we are not different. We are not enabled from outside. No. We are part of the industry. Health tech is part of the healthcare industry, right? So those failures that we bring, it should be like get benefit from the healthcare business, and also to do more, to even like further, and even like for the government. I don't say cut the budget, right? But how to optimize. I mean, Indonesia is going to spend. We only like 3% GDP healthcare. It's crazy, yeah. Everyone like 3%. Doesn't make sense. Even at 10%, it's like very limited. We only 3%. But you can imagine 10% of GDP Indonesia, hospital will collapse. The hospital will collapse.
Thank you.
No, I think we great discussion. Thanks for having us. I would say we went slightly above the topic from digital twins. We went to broader healthcare and how technology can help, which is also a big thing to solve for. But I think if I conclude on digital twins, like we have discussed, there are multiple applications from clinical trials to hospital management. I would say for a country like Indonesia, organ transplant. There is a big use case of saying how digital twins can help to do the matching and the whole system. So I think as an ecosystem, we all need to go back to the government and say, let's just implement this use case, start from there, and then there are many things. Thank you for organizing this. It was a great time. Thanks for having us. Very important.
support me as well. I think that's all for today, our podcast. I think one of the next point that we want to have is cooperation. So that a lot of people we can define the climate level. And we also that we will have series later on by next year. Regularly. Of course, will be not very tough this one. That is one of the number of activities. But we have a big question. Yes, I think that's all for now.
Thank you.
Thank you.
Thank you.
Thank you.